So you don't have you have any
So,
specifically on that.
right, but if I do this and enlarge it, this
Yeah, like, but then you're just right. But what I was saying, like, there's not a need to. So you can stream live from Zoom on YouTube, but just don't let that. Oh,
let's do Zoom, and then if we need to download YouTube and replace it, we can.
Testing Chambers audio. Thank you. Board of Commissioners. It is now 7:01 p.m. and I will share the public charge. The Board of Commissioners asks its members and citizens to conduct themselves in a respectful, courteous manner, both with the board and fellow citizens. At any time, should any member of the board or any citizen fail to observe this public charge, the chair will ask the offending person to leave the meeting until that individual regains personal control. Should decorum fail to be restored, the chair will recess the meeting until such time that a genuine commitment to the public charge is observed. And as a courtesy to others, please turn off your cell phones, mute yourself during the meeting, and we will start with a moment of silence and all the things that we have to be thankful for today. Thank you. Are there any agenda adjustments this evening? Seeing none, I will move on to the announcements. Durham County Nonprofit Agency Funding Program. Durham County began accepting applications for our COVID-focused nonprofit funding program on October 15th. This 18-month program will run from January 1st to June 30th, and we are seeking proposals that are related to COVID recovery and response in the areas of food security, child, youth, and family wellness, and workforce development. We are also funding efforts in housing and home repair that we are working with the city on. The deadline for this program is this coming Thursday, November 12th, and the awards will be announced in early January. So we encourage everybody to please apply. If you need help, to reach out to Durham County staff, and we will have more information about the application in our announcements and on our website. The HOPE program, which aims to help prevent evictions and utility disconnections, is up and running out of our DSS department, and also you can apply online. This is for low and moderate income renters who are experiencing financial hardships due to COVID-19. Renters can call 211 or go to www.nc211org.hope. You can apply in both English and Spanish. And I just really want to really applaud our DSS staff. I know that about a week ago we had gotten 1,000 applications in 7 days, and we have 18 or 19 staff working full-time just processing these applications. And it's thanks to us already having an eviction diversion program that we were really able to get this program up and running. So we know there's a lot of need out there, and we encourage people to reach out for help. Durham launches the CARES Small Business Grant Program. This is a new program being launched by the City of Durham. $240,000 worth of their CARES Act fund money is being used to provide direct grants to negatively impacted small businesses. The applications are opening on November 12th, on Thursday, and awardees will be notified on November 30th, with funds being released mid-December. And we know there's a critical need for this grant program. Again, we'll have more information on our website, and there's information on the cities as well. Durham Recovery and Renewal Task Force website launch. Have you ever wondered how we are I and the mayor and others are making decisions related to our response to COVID-19. You can go to our website to find out more about the Recovery and Renewal Task Force that is playing a key role in our community's response to COVID-19. Again, the website is durham.nc.gov/4329/recovery-renewal-task-force. But it has all of the meetings are there, the YouTubes of the meetings, all the roundtable meetings that people can join, and agenda materials. So we hope that everybody will check out that website. The 2020 virtual 5K and 10K, 2020 emergency chaplain run, 5K, 10K run will be completed virtually this year, and participants are invited to sign up by visiting www.echap.org/run. And this will take place between November 1st and 30th, where people can either walk or run, and we'll use a Race Joy app, and there will be awards and prizes. And that completes our announcements. Are there any additional announcements from board members? Commissioner Howerton.
Thank you, Madam Chair. I just wanted to, there are a couple of things. I just wanted to acknowledge we've lost 2 giants in our community over the last week or so, Ed Stewart and, everybody know Skippy. History buff, been known in this community forever, just very well known, and I just wanted to lift them up and lift up their families in prayer, and that this seems to be a really, really tough time, that we're losing so much of our history right now. We're just losing people. So just wanted to lift them up. And if anybody want to say anything about that, and then I have one other thing I want to lift up.
Well, thank you, Commissioner Howerton. I'm so glad you shared that. Two giants in our community, Ed Stewart being an important part of UDI for many, many years and being a business leader in our community, and Skippy, who, every time I got a chance to be by his side so I could hear more of his stories, was really a treasure. And I want to acknowledge Queen also, his wife, his incredible wife, and just the whole family, both families. So thank you for bringing that to our attention.
Madam Chair, I'd like to say I knew them both, and my sympathies go out to their families at a difficult time.
And I have one other thing. I just can't like to take the opportunity that we're having a conversation just before we started the meeting about what's just happened the last couple of days. And I am just so pleased about the election and how Durham County voted. We voted 80.56% for President-elect Joe Biden and Vice President-elect Kamala Harris. Unfortunately, we were not as successful across the state in other races. National experts and pundits are saying this election was overwhelmingly supported and won through the work of many coalitions, but in particularly Black and brown women. For the first time in history, a woman, a Black woman, an Asian American woman, a woman of color will be the second most powerful person in this country. Wow. Words can't express the elation I feel for our Black and brown little girls as we were talking about little girls a minute ago, all of our girls across the country who will grow up seeing Vice President Kamala Harris lead. She looks like and represents them. I believe many lessons have been learned through this election cycle. It is time to stop expecting unwavering support from Black and Brown communities and offering broken promises in return. It is time to be more inclusive and diverse in leadership. It is time to acknowledge, respect, and support Black and Brown women's leadership. It is time for those who have historically been left to step back and watch us lead at the national and local levels. Black women have been supporting and leading in the background for centuries. President-elect Biden realized he needed a proven partner to help him lead and heal our divided nation. He made the right selection. He did the right thing. I have said this many times, and it is worth repeating. Using the language of racial equity and not implementing the principles is empty talk. This is what racial equity looks like when we truly walk the walk. Next critical work requires those who truly appreciate that historically Black, Native American, Latinx, Asian Americans, and other women of color have been left out of leadership opportunities for decades and centuries because of systemic racism, are now willing to step back and support women of color to lead at the highest level. Finally, I am delighted to very soon and very soon, welcome my newest county commissioners, Namashina Burns and Netta Alam, to the board. There is important work we must do in our service to Durham County residents. Thank you, Madam Chair.
Thank you, Commissioner Howard. And for, again, what we were talking about before the meeting started, recognizing the historic nature of this election. And it's incredibly exciting. And there are so many firsts that are going to be happening with our new president and vice president, and all of the having our first husband or second husband, whatever we're going to call him. And I also want to recognize all the people in our community that worked so hard in our election for Durham to get to that 80%.
80 is at 80.56%. We don't want to miss that 56%.
56% and nearly 75% voter turnout. Well, actually, I think we got to 72 point something percent, so nearly 73% voter turnout. There was so much grassroots engagement from our community people, canvassing, phone banking, working at the polls, writing postcards, working beyond Durham County, working across the state. And it's going on right now. People are canvassing to help get people like our Chief Justice Beasley over the finish line. And so it's ongoing. And I've just never seen the kind of hard work and engagement from our entire community during this election. And I hope it's a foundation that continues, and especially with young people. So many young people that were voting and were involved and have been leading. So I think we know the wave of the future. Stacey Abrams, we were lucky to have her here in Durham. I was lucky to meet her and have that honor, but she has, she's shown us the way forward. So we know what we need to do. And don't know if other board members wanted to comment as well. Okay. All right. Well, thank you. So we will move on to our minutes. We have the regular session September 28th, 2020, and work session October 5th, 2020 minutes.
Move approval of the minutes.
Second.
Moved by Commissioner Reckow, seconded by Commissioner Howerton, and we'll take a voice vote. Start with you, Commissioner Hill.
Aye.
Commissioner Carter.
Aye.
Commissioner Howerton.
Aye.
Commissioner Reckow.
Aye.
Aye. So the minutes are unanimously approved. We have an important ceremonial item tonight, which is a resolution for Veterans Day. And do we have, I see Lois Harvin Raven. Are you here with us this evening? Our Director of Durham County. You are, Lois. Great to see you. And I don't know if you have any of your staff here as well tonight. Oh, there's Jonathan.
Crooms is with us.
Jonathan, great to see you as well. Is Lindsay here too? Lindsay Atkins?
I think he is.
Lindsay, do we have you? We don't want to leave you out, Lindsay. Okay, well, maybe he'll come on in a few minutes. So I will share this resolution. Oh, and I forgot, actually, I'm going to make sure I read the announcement also about Veterans Day, which this got added afterwards and I forgot to read in the announcements. But I'll first read the resolution and then we'd love to hear from you, Lois and Jonathan, because you have a lot planned for Veterans Day tomorrow. Durham Board of County Commissioners Resolution for Veterans Day 2020. Whereas each year our nation pauses to pay tribute to the many men and women who have pledged their allegiance to the United States Armed Forces, and whereas their loyalty to the military is evident in their commitment and willingness to make sacrifices to protect our country, and whereas their faithfulness and courage commands respect, as many have stood in the face of our country's adversaries to protect our freedom. And whereas the United States Congress passed a concurrent resolution on June 4th, 1926, calling for the observance of November 11th with appropriate ceremonies, and later provided in an act approved on May 13th, 1938, that the 11th of November in each year should be a legal holiday, celebrated and known as Armistice Day. And whereas on June 1st, 1954, Congress made an amendment replacing armistice with veterans. And whereas November 11th is Veterans Day and set aside as a legal state and federal public holiday to honor our nation's veterans. And whereas it is hoped that we are inspired and our bond as a nation is strengthened as we gather on Veterans Day to recognize the patriots across our great nation and the nearly 15,000 veterans of Durham County who have defended our rights, values, and freedoms. Now, therefore, be it resolved that we, the members of the Durham Board of County Commissioners, do hereby resolve that November 11th, 2020, as Veterans Day in Durham County, we urge all citizens in Durham to observe Veterans Day 2020 by displaying respect and gratitude for our veterans, both living and deceased, through appropriate services and ceremonies recognizing their great sacrifice. This, the 9th day of November 2020, Wendy Jacobs, Chair, James Hill, Vice Chair, Brenda Howerton, Heidi Carter, Ellen Reckow. So thank you so much for bringing this to us, and we appreciate all that you do for our veterans in our community. We'd love to hear you talk about what is planned for tomorrow, because there is a lot in store, and that COVID-19 is not stopping Lois and Jonathan and Lindsay. So thank you.
Well, thank you, and thank you, Mr. Manager, Madam Chair, Commissioners, General Managers, and colleagues across the enterprise. Thank you again for being such a great supporter of our nation's veterans here in Durham County and across the nation. This resolution may be viewed as just mere ceremonial, but for our veterans here in Durham, it represents far more. The Board of County Commissioners made a conscious decision to endorse this resolution because you believe our veterans matter, not just now on Veterans Day, but throughout the year, in spirit and in body and with financial support. In fact, this very support is what will allow the County Veteran Service Office to host both the veteran presentation at 11 a.m. and the drive-through of honor that will take place at 1 to 2 p.m. on Veterans Day, Wednesday, November the 11th.
Yeah, not tomorrow. Not
Jonathan Crooms, our Outreach Veteran Service Coordinator and co-host of the virtual program, will briefly share with you about the event in a moment. What will the drive-through of honor look like? During the drive-through of honor, we will announce each veteran as they drive through. We will provide them a swag bag filled with lots of gifts and PPE gear consisting of masks and hand sanitizer. This drive-through of honors includes our veterans who may be walking, and we will have a designated safe area for them to access their gift bags as well. We understand there is a 90% chance of rain on Wednesday, but we will move forward with this event, rain or shine. We made provisions for tents to be erected in the Human Services parking lot. They will be inspected by the fire marshal to ensure our veterans and our guests' safety. I want to thank Mike Webbs. Last night, past 11 o'clock, we were on emailing back and forth. I was in the office, and apparently he was in the office or working from home. And I want to thank him because this is indicative of Durham County's employees across his enterprise. His last comment to me, Lois, I got your back. You know, when you're trying to get something done for the first time, trying to put things together, it's so wonderful to know that you have colleagues that will stand by you and help make things happen for you. And lastly, I want to remind our veterans, those that have become accustomed to the spirited part of our annual Veterans Day event, the gift cards that our very own Wendell Davis, our county manager, we call him the ticket master. He has the pleasure of pulling all those winning numbers for so many lucky veterans and supporters. So during the annual event, we will still give out gift cards randomly, so please come out and join us and make this a memorable pandemic Veterans Day drive-through of honor event. We are imploring all participants to please wear your mask, as we will be wearing our masks, and walking participant, we're asking you to please practice social distancing as we seek to bring an end to this COVID-19. And so again, it's on Wednesday, November the 11th, which is Veterans Day, and Jonathan will give you a little detail about the virtual event. And thank you again to all of the Madam Chair and the Commission. We certainly appreciate your support.
Thank you.
Commissioners, thank you again for having us. And we have a wonderful program set up for Wednesday. Certainly nothing can replace our traditional program where we're all together celebrating our veterans and over a good meal. But in the midst of this virus, we still do have a really wonderful program virtually. My colleague, Lindsay Atkins, and I will be co-hosting it. We have a special treat this year. We have a live bugler. Dr. Bruce M. Klitzman from the Durham Medical Orchestra will be playing the national anthem and taps on the bugle, and he will be terrific. We also will honor our veterans and our country with the Pledge of Allegiance, as well as a reading of a purpose of Veterans Day. And we will also read the resolution, which you all are about to adapt. Anytime that we gather and celebrate our veterans and their families, we also remember the veterans who can't be with us and whom we may not know where they are. So we will also have an observance of the POW MIA remembrance ceremony as well. The ceremony can be viewed on the Durham Television Network, Nextdoor, Twitter, Facebook, YouTube. You name the social media outlet, you can find us on there. And we'll be thrilled to have you all with us. And then if I may just offer one thanks to Randy Jones for all of his support in helping us to publicize our events. He's always very supportive and has once again helped us as we get our message out to the community. So thank you.
Well, thank you. And I apologize for mixing people up. Veterans Day is Wednesday, November 11th. And Lois and Lindsay and Jonathan, they are making sure it's still going to be a very, very special day with the virtual ceremony program at 11 a.m. on everything you can imagine, as Jonathan said. Just want to reiterate that. And then the drive-through of honor from 1 to 2. So we want, that will be again at the Durham County Human Services Building parking lot, corner of East Main and Dillard Streets. And I will say I'm going to really miss Lois not having something in person. This is a day that I always look forward to. You all always make it very, very special. And so it's another one of those things that we're missing this year. But thank you for making sure nobody is going to be overlooked or ignored and recognized. And I think, Lois, you said that there is a 98-year-old World War II veteran who may come by. Is that right?
That's correct, and we're looking forward to when we have a special treat for him should he show. But he called early on. He was the first caller. His family called, and he's a World War II veteran, as you indicated. And we're excited, and we look forward to having him.
All right, so we welcome everybody to come and be celebrated. Thank you so much. Thank you for all that you do all the time. Thank you. So next on our agenda is consent items, and just wanted to see if anybody had any questions on any of the items or anything that board members wanted to recognize, give a shout out about.
They've gone already. Well, before Lois, before we go there, Madam Chair, I'd just like to say thank you to Lois and Jonathan both for acknowledging our veterans. They consistently do that, and we should always lift up our veterans. So thank you so much for the work that you do in looking after our veterans. I just needed to acknowledge that.
So consent agenda items.
Madam Chair, I would move approval.
Second?
Second.
Okay, so I think it was moved by Commissioner Reckow, seconded by Commissioner Carter. And before we vote, I just wanted to give a shout out for some of the great items on there. The continuing funding for the Back on the Bull media campaign that has been really doing a great job of spreading the word about Back on the Bull. The McFarland easement, thank you to our open space staff for another farm protection, and the excitement I have for us funding our renewable energy plan that is on our agenda tonight to help reach our climate change goals. So we will take a voice vote, and we'll start with Commissioner Howerton.
Yes.
Commissioner Reckow.
Yes.
Commissioner Carter.
Yes.
And Commissioner Hill.
Yes.
And I'm a yes, so the consent agenda is unanimously approved. We have a public hearing tonight. And I know Drew Cummings, our Chief of Staff, is going to help us with this item. Drew, could you, this public hearing is the first public hearing for public impact on the Durham public input on the Durham County CDBG CV plan. And this is a very important plan and opportunity. And I will turn it over to you, Drew, to tell us and the community more about this before we open the public hearing.
Thank you, Chair Jacobs, and good evening, Commissioners. Can you hear me okay?
Yes.
Great. Drew Cummings, Chief of Staff. As Chair Jacobs mentioned, this is the first of 2 required public hearings that Durham County must conduct prior to submitting an application for these funds. This CDBG CV grant funding comes through the North Carolina Department of Commerce Rural Economic Development Division. And this stream of funding is for non-entitlement entities. So organizations like the City of Durham that receive CDBG funds as a matter of course are not eligible, and entities like the Durham County which don't receive CDBG funds as a matter of course are encouraged to apply for funds like these. The maximum grant award is $900,000 to be spent over up to 3 years. And critically, all grant funds have to be spent outside the city limit. The grant funds can be used in a wide variety of ways to benefit individuals of low to moderate income who've been negatively impacted by COVID. County staff have, of course, given considerable thought to the question of which applications of funds would do the most good and be most feasible for county staff to implement. But the purpose of this public hearing is not to present a plan or even a draft plan, but rather to hear from the public and also to see what questions and ideas commissioners may have. Obviously, with our online meetings, this is not really a typical public hearing in that we are only able to take written comments. Despite advertising over 3 consecutive weeks in the Herald Sun and sending information out over all of our standard listservs and social media, we have not received any comments. I was contacted by one citizen who decided to wait for the second hearing and to review our draft plan. But given how we are and are not able to do public hearings, I think I will hand it back to you, Chair Jacobs, to open and eventually close that public hearing and see what other questions and comments there are with regard to this item.
Okay, well, thank you, Drew. Well, I just want to really emphasize how important this opportunity is for $900,000 worth of funding that really can be used for so many of the critical needs that we have right now. Can be used for our food security needs. It can be used for rental assistance. It can be used to help our small businesses, to train workers. So, but I know it's only 900,000, and I would like to just hear, maybe after with the public hearing, you know, what kind of thoughts staff have at this time based on what the apparatus that we already have in place to respond to COVID and what we know the needs are and how this can be kind of most effectively used. So I will now officially open the public hearing. And Monica, I just want to confirm, has anybody submitted comments for the public hearing?
Hi, Chair Jacobs. No, ma'am, we have not received any comments for the public hearing.
Okay. So hopefully we will get more input and comments at the second public hearing because this is really important. So I will now close the public hearing, bring this back before our board. Commissioner Reckow.
Thank you, Madam Chair. I agree with your comment about this being an important infusion of resources, assuming we can get this grant. I was intrigued by the ability to provide support for broadband and communication support. We have heard so many complaints from our residents particularly the northern part of the county, about lack of broadband. And to the degree that we have low and moderate income residents who might need assistance, that could be a good thing. I know our IT department was going to initiate a study, and Drew's nodding. Drew, do you know what the timing is on that and how it might interface with this grant?
So I did talk with both Greg Merrow, Director of IS&T, and Jay Gibson about that portion of this, sort of back more when we were first reading through these materials. That study is out. I'm not sure exactly when the study will be finalized, but it's not my impression that the results of that study would provide actionable steps that the county itself could take, with or without money. And so we weren't really sure in the end that that would provide a helpful way of addressing some of those broadband issues that you mentioned that are very real. One thing we did do, though, that was suggested by one member of our staff team was to contact Durham Public Schools, which has distributed close to 10,000 hotspots to inside and outside the city limits to the households of DPS students. They estimate that they may be providing primary internet service for close to half of the population of Durham Public Schools. And so those are costing them money every month, and they are still in the process of determining how many of those hotspots have been distributed to students who live outside the city limits. But that could very easily be become part of our plan to support those hotspots and all of the activity, some of which is surely school related and some of which probably isn't, right? But it's nevertheless helping to sustain those families in a variety of important ways. So more on that to come as we get some of that additional feedback from the schools and see perhaps how it would fit with other aspects of a draft plan.
Yeah. And my only other comment is I was pleased to see that the categories were widened quite a bit, probably in response to the pandemic. Typically, CDBG money don't cover this number of areas, and the getting into more of the health and human services. So I was really pleased that there's a recognition of the extensive needs among our families at this point in time. So I hope that we can come up with the right formula that will make it so we can get these funds, because I'm sure they would be put to very good use outside our city limits.
We're hopeful.
And Drew, could you just give us an idea of what are some of the things that staff already are thinking about? Because I want to note that the application process actually opens September 1st. So there is a real concern and a need that we roll out something that is going to be quickly, we all submit quickly, again, that we can implement quickly. And thanks to some of the amazing programs that we have with FIG and with Bull City Schools and with our eviction diversion program, we actually have things that we know we're going to need continued infusions of cash, for the next year. So what are your thoughts, or what are you hearing so far from staff?
Correct. So 2 points that you made. One, that time is of the essence. It took us a little while to get some key feedback from the state and then to get in line for a county commission meeting. But we would anticipate coming back for the second public hearing relatively quickly with a draft plan, so that that can hopefully then be approved and submitted as part of an official application. The conversations with staff, which have included IS&T, as I mentioned, economic development, social services, public health, and cooperative extension, have been rich. Most of those departments are engaged in meeting what I would call kind of primary needs of our citizens who are having trouble maintaining their housing, and citizens who are having trouble getting enough to eat. We have a lot of citizens who are either on reduced hours or have lost their work altogether, and all of these other problems that they have are sort of associated with that drop in income. And so most of the focus of our group conversations was on how to continue adding resources to the mechanisms we have at the county for meeting those primary needs. And you know, $900,000 when you consider the scope of those needs is both a lot of money and also not very much money. And so we won't have any trouble figuring out how to spend this money if we are lucky enough to get it. It will just be a question of how we split it up amongst the various needs that we are aware of. So again, we did have some conversations about economic development and retraining. We have a very small one-person office, and so and when you consider sort of that the funds can only be spent to support low to moderate income individuals and businesses, hiring those individuals outside the city limits, the opportunities were a little more limited than one might at first have thought, looking at the application, which, as you noted, has lots of very broad categories. But even noting that something in that arena might be possible, our group conversations definitely tended towards a desire to meet real primary immediate needs. It is true that if we structure an application in a particular way and then discover that the need in one area is not as much as we thought it was, we can always come back and do a program amendment kind of process and reallocate funds. I mean, it's hard to imagine not being able to spend $900,000 on COVID-related things in 3 years. We'll probably spend it in 3 months. But we do have that right to kind of revise our program plan if the circumstances suggest that would be a good idea.
Yeah. Commissioner Howard.
Thank you, Madam Chair. Drew, can you tell us a little bit about how normally when we provide food, there's no distinction between county and city, people that live in the county or the city. How will we distinguish between providing for people that live in the county versus live in the city? Also, as far as housing, and the other one was business, how will you distinguish them, county and city?
Right. So I'll start with the easiest answer first, right? If somebody is seeking housing aid from us, we have their address, and so we would know whether they live inside or outside the city limit. So that would be the easiest arena in which to make those kinds of determinations. Food insecurity and food aid would be a little more challenging, and I know that the Food Security Task Force in the EOC has been talking to pantries and other food aid groups, some of which also deliver to addresses, but some of which operate more like a standard pantry. And the question we've had for them is how much information they're able to collect about the people that they're serving. And so, which is to say, in what sort of position would we be in terms of knowing who exactly we're serving and whether they're eligible to receive these funds. Another thing is that with these CDBG funds, I just remembered this other detail. If you are running a program that is sort of a broad program that area geographies of people might be eligible for, you don't have to prove that every single one of them is low to moderate income, right? Only that 51% or more are low to moderate income. And I think in that case, in the food pantry case, it might even be the case that a food pantry, just its location outside of the city limits, would make it an eligible recipient of funds. But it's a good question. On the business front, I would assume businesses would have to be located outside of the city limits, and possibly the individual, the low to moderate individuals whose employment would be getting preserved or created might well also have to live outside the city limits. But we're uncertain at this point, Commissioner Howerton, whether that would be would likely be a part of our draft plan or not. And the broadband program, which could be working through Durham Public Schools, would also be a situation where we would know the addresses of the households that had received those hotspots, so we would know for certain whether those people live inside or outside the city limits.
So the business can be located in the outside city limits. Now, what about the employees that work for that business? Do they have to live outside the city limits as well?
I will have to double check that specific question. I don't want to speak incorrectly. Andy Miracle, I think, is on the call. He may know the answer to that question. Andy, are you on?
Hi there, Drew. Hello, Commissioner. Andy Miracle, Economic Development Officer. I am not certain of that answer for sure. Drew, my assumption, like yourself, is asking about the proximity of the business itself. So that would be my assumption, but obviously we need to confirm that answer.
Okay, sounds like we still got a lot of work to do around getting the right answers. And the other question that I have is, what's the deadline for applying for the funding?
They're rolling applications. So as Commissioner Jacobs, Chair Jacobs mentioned, the window opened in early September. The rolling application period. So anybody, as I pointed out to her, any entity that wants to apply has to go through multiple public hearings before they can submit their application. And the notice of funding availability did not come out all that long before the rolling application window opened. So I think the earliest that any jurisdiction would have been submitting an application for this would probably be into October. So we're not too far behind the curve, but we can submit it whenever we're ready. My intent, working with our staff team, is to pull together that draft plan and be back in front of you for a second public hearing as quickly as we can organize that. Hopefully before the end of the calendar year. Should be before the end of the calendar year, and to get that submitted to the state.
But what's the deadline?
No deadline.
Apply. There's no deadline. Okay.
But the money will run out. The money will run out, so you want to get in as soon as possible.
Yeah, people just need to know by when they need to get it in, or it cuts off. That's my question. And you're saying there's no deadline.
Well, the county certainly would not miss any deadline by submitting an application, before the end of calendar 2020 or very early in calendar 2021. Are you asking about that, or are you asking about people who would then be looking for support from the county through the grant funds?
I'm asking about the people that may want to apply and fill out an application. Is there a deadline by when they need to get the application in?
I see. So the county is the applicant in this situation. This is not something that an individual or an individual business can apply for, unless, for example, if we did include in our draft plan and got funded a portion, sort of a grant program that would include some small business assistance, for example, or retraining, then we would have to work to figure out which businesses we would be working with, or how the small grant program would be implemented. But again, I want to emphasize that thus far, in the staff conversations, the possibility of carving out a kind of a business-oriented assistance program outside of the city limits has not been high up on the list of possible programs that we've been discussing. It's certainly eligible.
So maybe I'm not clear about my question. My question is, even if they're going to get the information to the county, there is no deadline, there's no cutoff date as to when they have to get it in, or they can apply?
When you say they, are you speaking of a business in Durham outside the city limits?
I'm talking about businesses or they're applying for the food or to whatever they're trying to get from the county. What's the deadline date?
I see what you're saying. So if, for example, let's say that we included in our draft plan and our application, let's say we wanted to put $400 of the $900,000 towards helping people with low to moderate income individuals outside the city limits with back rent or missed utility payments or something like that. What we would probably do is distribute those funds through the same DSS offices, right, that are delivering crisis assistance and various kinds of eviction prevention funds that are doing that now. This would just be an additional pot of funds, and when somebody came in with a county address, this would be an additional source of funding to potentially help those individuals. So the deadline for spending grant funds, if we get an award, is 3 years. So if we get an award, there should be no problem at all spending it, almost regardless of what we would opt to spend it on.
Okay.
I hope that's clear. Sorry,
Thank you.
went in circles for a minute. Yeah.
Any other comments or questions from anybody? Commissioner Carter?
Just a quick question. Thanks for all the information. Do you believe, does staff believe that we're going to be able to get a sort of a good feeling for what the demand is in the unincorporated area on the part of low to moderate income residents for services in each of the different areas? You know, like what's needed the most? Do you think we're going to have a sense for that?
So I checked in with Peter Gilbert and John Killeen early on to see if we could get county-only sort of eviction filing information. And I certainly think that there's definitely some activity outside the city limits. The bulk of it is inside, but you know, there's enough outside the city limits certainly to justify some additional funds that are particularly targeted at residents who live outside the city limits. You know, we'll take another look at that data when we're kind of creating a draft plan and kind of try to calibrate a little bit so that we don't want to put, you know, 3 times as much money in that pot as we think we're going to need, nor do we want to put 1/3 as much money as we might need into that pot. On the food side, you know, I think we have quite good information on levels of activity at food pantries and churches, you know, who are distributing food outside the city limits. You might have to fine-tune that a little bit because sometimes those are being frequented by a mix of people, some of whom live in the city and some of whom live outside the city. So there's a little bit of fine-tuning that we need to do there too. But I would say in both cases, we have enough data, I think, to do a pretty good job estimating. And again, with 3 years, right, even if the level of evictions and back utility payments for low to moderate individuals outside the city limits is not that high, it'll get spent. It'll get spent.
Right. Sure, you're right. Thanks.
Yeah, that was a great question, Commissioner Carter. And I would suggest, Drew, also checking in with DSS staff because we have a waiting list right now of over 400 people waiting for meals, for Meals on Wheels. Again, they will know exactly where those people are located. And so, you know, I think one thing about the rural areas is that the poverty can be hidden because people are down back roads and they're not as visible, but it is there. The need is there. The need is absolutely there. And we have a lot of seniors who are living out in unincorporated areas as well, who really need help. And again, they may not be visible, but they're there. And so we really have to track them down. Even people like Lois and her team know about veterans out in our community who might need help. So I think we really need to work with our departments and connections. For instance, I'm a member of the Rougemont Ruritan Club. They're doing food drives all the time in Rougemont because people need food. So that's a definite need. And like you said, you can get the data coming in for the rental assistance and utility assistance from DSS. But also, I had a meeting last week with the chair of the school board, and we discussed one of the topics was about whether what's going on in the unincorporated areas of the county related to digital access for DPS students, and they definitely need help, especially in the more rural areas of the county with DPS students. And so they probably have that, or the digital equity, Durham Public Schools, the Bull City Schools. And that's such a powerful way, again, to contribute, because as you mentioned, Drew, when people have the internet, the broadband, and they have the devices, then it can help the whole family, whether they're using it for virtual school, or they're using it for work, or for telemedicine, or for church or synagogue, or whatever. It has so many benefits. So I'm excited about this and looking forward to the plan that you come back with us to bring back to us as soon as you can, so we can get that money.
Yep. I wanted to mention that our DSS director Ben Rose and assistant director Janine Gordon and at least one or two other people have also been involved in the planning meetings. So they're
good.
well aware of the opportunity, and we'll have all kinds of input into how, especially any housing assistance kind of portion of the application would be structured.
Okay, great. And even Durham Center for Senior Life, or Melissa Black, she may be a good resource related to what needs of seniors.
Janine Gordon is quite well connected at DCSL, and so in our conversations with her, she's been sort of making that connection and been key to kind of helping the left hand know what the right hand is doing.
Right. Okay. All right. Well, thanks so much to you, Drew, and the whole team of staff that's working on this. Thank you. All right. And so next we have a Durham County Public Health report from Rod Jenkins. Hello there, Rod. Good to see you.
Hello, Madam Chair. How are you?
So looking forward to getting an update, Rod, from you on what's happening with COVID-19 in Durham County.
A lot happening. So to you and the other members of the Board of County Commissioners, I say good evening. As I normally do on the commute home, I listen to NPR, and I heard a quote that I hope you don't mind me giving to you, but it just says, life can be hard by the yard or cinched by the inch. And I just want to say public health, in partnership with our partners at the ELC, have definitely traveled some long yards this year. But we are most certainly encouraged and grateful for the support of our Board of County Commissioners. You guys have been with us every step of the way. And in addition, as we inch closer to the mass distribution of a COVID vaccine, my briefing does come the same day as we have been provided with some encouraging news that Pfizer has developed a vaccine that's currently 90% effective in its trials. And this is certainly promising, exciting news for COVID plans, but we are even more excited about the fact that we do have a president-elect and a transition team that has assembled some really, really heavy-hitting medical experts who are really deeply believe in the science, and they follow the evidence of the science. And it's just encouraging to know that we all will be playing from the same place. There's not going to be any disparate actions from one side of the nation. It's just all unified, and that helps the entire country when it comes to a pandemic. So I just wanted to start off by just kind of giving that quote and giving an update as far as the good news that we've heard. As far as the statistics, we do sit at 553 total active cases. We're at 9,201 inactive or discharge cases of COVID in Durham County. Since the last time that I've been able to give you a briefing, we've had 3 additional deaths. Our hearts and our prayers are with those families of those people who have lost loved ones to COVID-19. It brings us to 105 total cases of COVID, total deaths to COVID, excuse me. And our total since the pandemic began as of right now is 9,865 total cases. Just want to give some statistics for the month of October. Our 7-day moving average as of last week was 61. This is an increase from an average of 43 2 weeks ago, a week ago, and 44 the previous week. So we can see that we're kind of making that balance. And it is most certainly a result of a number of different factors, to include testing, which is robust, and I'll touch on that a little bit later. But it's also because of congregate living facilities that we're starting to see sort of a repeat of what we had in the spring, where there were a lot of long-term care facilities that were having outbreaks. We're kind of seeing a little bit of that as of late. So suffice to say, the trajectory of lab-confirmed cases, not only in Durham County, but also in the state, is increasing as well. In terms of race, ethnicity, and work, which we are committed to looking at COVID through a racial equity lens, I'm proud to report, and I had to do some checking, members of the Board of County Commissioners, I do believe that this may be the lowest percentage for our Latinx population since the pandemic began. But right now, they're sitting at 29.11% of all of our cases for the month of October. Does not negate the fact that it needs to be under what they represent, which is 14% of all of our residents. But it does speak to the enormous effort that has gone unchanged, undisturbed, to continue to get the word out to our brown brothers and sisters in Durham County in an effort to keep them safe from COVID-19. So again, big thanks to all of our healthcare coalition and our partners in getting that done. In terms of Black African American, they continue to be proportionally represented at 32.42% of all our cases. And our white Durhamites continue to be underrepresented at 29.7% of all of our cases in Durham County. As far as industries, we continue to see construction workers, janitorial services, and as mentioned previously, nursing care facilities being affected by COVID-19 in their workforce. 52.94% of all of our cases were associated with janitorial work, and they were of the Hispanic population. Again, 82.86% of our cases were associated with construction work, mainly Hispanic males. 48.5% nursing care facilities, African American females dominated that. A positive lab percentage, again, we continue to look at the state's percentage, and we continue to look at the Duke model, which we're grateful to receive every Wednesday from Duke. Last week it was 5.5%. The prior week it was 4.8%. Per Duke's model, it was 6.3% for the entire state. Durham's infection, according to Duke's models, last week was 4.8%. So again, we still remain below 6%. We're not doing as well with it being above 5%, but it's just a half percentage point above 5%. So that does indicate that positive tests as a percentage of total tests is increasing, not only in North Carolina, but also in Durham County. We continue to keep a close eye on COVID-19's impact on school-aged children, particularly in preparation for any particular action that Durham Public Schools may be wanting to take as far as next semester. For the entire month of October, 12.9% was the percentage of all cases involving individuals who are under the age of 18. That continues to be a relatively low, but of course we want it to be even lower. But nevertheless, we're continuing to protect the most vulnerable, which is our children. As I mentioned previously, a lot of testing has been going on, and testing, as you all know, and tracing is excellent because that's how we fight the pandemic. Over the past 2 weeks, I'm proud to report that Durham County has been testing in excess of 8,000 tests per week over the past 2 weeks. Total tests for the month of October was approximately 29,646 total tests for a weekly average of 7,412 tests administered. Again, I just thought it not robbery to bring that stat to you all because, again, at the beginning of the pandemic, testing was not in abundance, and we've come a long way. And that's how you really find out where the infections are. I am even more proud to report that testing is certainly in abundance. We do have the addition of the COVID-19 surge testing resources from the state. That's still in 4 of Durham Housing Authority's locations. We also have drive-through testing at El Centro Hispano, and that's normally Tuesday through Saturday. And also on the weekends, we are also offering drive-through testing at the Health and Human Services parking lot, and that's on Saturdays and Sunday. In addition to that, we have our 9 CVS sites, and we also have our Walgreens site, and that is also in addition to everything that Duke, all the great work Duke is doing, in addition to the Fast Med. So the state has a website, Find My Testing Place. All of those sites are listed there. So to the residents of Durham, if you need a COVID test, it is available for you. You can get tested. Contact tracing continues to go well. I think I might have mentioned the last time we did request additional resources, and they are currently being trained in anticipation of this dark winter that it is being forecast that we will have to endure in Durham County. Madam Chair, every so often you always want me to give an update about the food and the wraparound services that's available. Happy to report that Durham continues to do well with this. I will say Duke University Health Systems represents Region 3, and they have expanded their footprint. As you recall, at the start, it was Durham, Granville, and Vance were the 3 counties. They have added on Wake County, Warren County, Franklin County, and Nash County. So they're providing resources for all of those counties. Nevertheless, Durham has not been neglected. We still have our community-based organizations that are providing great service to Durham County. As far as metrics, total dollars amount that have been administered thus far has been $116,899.25. This has also been resulted in 442 food boxes, 5,836 meals, 4 transportation services, 5 medical deliveries, 300 COVID supply boxes, for a total number of households of 211 total households served. Last thing I will say is that we also provide good news in that the wraparound services and the rental assistance or the monetary assistance is going to be increased. It's going to be based upon a sliding scale. Not exactly sure what the formula is, but in my conversations with Duke, they did say it's going to be significantly more than the $400 for an individual and $800 for a family. So all of these resources are coming at the right time because it's needed. As we've said throughout these meetings, there's a lot of people who are in need of a lot of services. We're proud to be able to provide it. That concludes my presentation. Happy to answer any questions you may have.
Thank you, Rod. And you talked about some of the new testing, and I know it's great we're doing that testing at the Durham Housing Authority communities. And I didn't know about Health and Human Services is doing drive-through. What are the hours for that? And do you have to have an appointment in advance for that?
No appointment in advance. You didn't know about it, Madam Chair, because it's brand new. We just started it last Saturday.
Okay.
And it went without a hitch. And we are offering it from 9 a.m. to 7 p.m. Saturdays and Sundays, again, 414 East Main Street, inside our parking lot. We do it on the weekends because there's not that much traffic. At El Centro Hispano, which is 2000 Chapel Hill Road, it's being offered Tuesdays through Saturday. And that's from 10 a.m. to 6 p.m. at El Centro.
Is that also drive-through too, or is that?
Yes,
Okay.
ma'am. That's also a drive-through. And in addition, how dare I forget, we still offer testing at our Holton site, which is Tuesdays and Thursdays and Saturdays.
Wow. I mean, it's amazing how the options have really increased. It really is fantastic and really important as we're going into this increase. So yeah, let's all spread the word. This is great. Commissioner Recco. You're muted, Alan.
Hi, Rod. I wanted to ask you, I downloaded the Slow COVID app about 5 or 6 weeks ago. It was being promoted by the state. I think I watched one of the governor's press conference and it was mentioned. My question is, have you gotten feedback in terms of how much this is being used, and is it helping your staff in terms of making it so the notifications are easier if someone who has the app were to get COVID? I was just curious because with our cases going up, it seems like using the app and publicizing it more could help make it so that contacts could be reached very easily.
Indeed. Thank you, and good evening to you, Commissioner Reckow, and thank you so much for that question. At last count, they said that we were approximately at 30,000 downloads of Slow COVID NC. Thank you for the plug for the app. It is making it a little bit easier for our contact tracing efforts. But the thing to remember is that with the contact tracing and how it's working, there's a central call center, if you will, that the state has established for contact tracing. So a lot of the Slow COVID NC information is it flows to that call center, and then of course we get involved on the back end. But it is my understanding that it is helping to alleviate a lot of the infections, and we certainly want everybody to download it if at all possible. I think you can attest that it doesn't interrupt any of your other functions on your phone, and oftentimes no news is good news when it comes to Slow COVID NC, because that means that you have not been around or in the presence of somebody who's identified themselves as a COVID positive individual. Do have a toolkit that we that came down from the state that also encourages us to provide that information about Slow COVID NC on our county's webpage, and I do believe our Public Health Department PIO has put that out there. So again, we thank you so much for bringing that to our attention. It is working.
Well, I guess I assume Deborah's on the call. Let's see if we can push it out pretty hard over the next couple weeks, because we're a pretty tech savvy community, and it seems like so many people have smartphones that this is a very convenient way. And I think the big thing is that there's no intrusion into your privacy. You know, when we first read about the apps, people, I guess, were concerned that the government would know where you went. It doesn't work that way. And if you read the background, it doesn't capture locations. It's just they use something else to detect, what do they call it?
Tokens.
Yeah. And so if you go to a store, it's not naming the place, it's just establishing that you had a presence in a location, but the place is unnamed. So it really is a great invention, and seems like it's a good way to go.
You guys are amazing. I tell you, every time I come, like, you guys have so much public health information. Deborah Craig, before she leaves, we need like a little commercial testimonial from her.
Absolutely.
Put it on the website. There it is.
Thank you, Commissioner Redcar. We will definitely incorporate this into all of our social media over the next month or two. We will make sure everybody in Durham County knows about this app.
And maybe we could work, Deborah, with our universities and see whether we could get new NCCU, Durham Tech to, because the students, you know, are a vulnerable population in terms of being more mobile around the community, and they could help protect themselves and others by using the app.
That's great. We have our Public Information Council, and we will reach out with that vehicle and get the word out to the university.
Okay, thanks.
We actually have an education roundtable, and the meeting will be coming up soon. So, Rod, you'll be on that call, meeting.
Actually, we got another month. We had the roundtable last week.
Oh, did I miss the education roundtable?
Yes, you did.
Oh my gosh. What was I doing?
It was well attended. I don't know. It was well attended.
Okay.
And all of our colleges, by the way, are doing extremely well.
Yeah. So we want to make sure that we've got a good vehicle through them, and even without the meeting, we've already have that we have that round table. So getting it out that way would be easy. Yeah. Commissioner Carter.
Yes, thank you. On just piggyback for a minute on Ellen's enthusiasm for that app, I agree. I wonder if there's any way we could make testing linked to downloading that app, or anything like that. At least be sure we let all those 8,000 people that are getting tested every week know.
That's a great suggestion. I think probably what we could do is just kind of promote some type of flyer to where once they test it, we hand them the flyer and encourage them to download it. Just about everyone has a mobile phone, so.
Yeah, great idea. How are we feeling about support for the homeless population, especially in light of, I guess it was last week when we had a large outbreak at Urban Ministries, and I haven't heard anything this week, so I was sort of surprised pleasantly. I know that the Duke model had us fight perhaps with the spike again, and so anyway, how are you feeling about that, Rod?
I feel confident, and we thank you, Commissioner Carter, for attending those meetings of the homeless support task force. Those are some long meetings. It's a lot of worthwhile information. I like the way that everybody kind of thinks about the what ifs. What if this happened? What if that happened? I feel good because Drew does a fantastic job along with Colin Davis, who works for the city. This is something they've been doing for months in terms of meeting and planning and organizing. I do believe that we dodged a bullet early when you guys appropriated the funds for the Marriott RTP. I think Drew has said it several times in emails to you all that it's almost a miracle that we went this long without some major event happening. I just feel confident because we've all been kind of in ready mode and practice mode, if you will. When something happened and we get the call, then we do what we need to do. Precautions have been made in terms of the duplex and the Carolina Duke Inn in terms of making sure that there's a place for them. But of course, we certainly need a much bigger venue in case something truly catastrophic does happen. But other than that, as far as the supports are concerned, be it from Southwest, Project Access, to our own public health staff that's dedicated to this population. I feel like we're in a good place.
Very good. Thank you, Rod.
So Rod, related to that, has that outbreak is that under control now at Urban Ministries? Have we seen that contained?
I would say for the moment, I do believe that we are still waiting on some additional results, but the first round of testing went well. They were, as Commissioner Carter mentioned, we were expecting more positives, but I believe that we only got one additional positive, so that's definitely promising. But we're grateful to Jake Feigl and Duke for continuing to go through and do the testing, because that's how you really find out what's going on. And instead of waiting, they're continuing to press forward with the testing. So I do believe that we still are waiting on some of the results, but again, we're going to continue to accentuate the positive and be prepared for the what if.
Right. And do you know, are we okay with adequate places for people to go? Do you know about that?
In terms of, from my understanding, yes, because we did have some vacancies with the duplexes. There was some individuals who were there whose quarantine time had already run its course. So there's supposed to be some room there. And I do know that we do have vacancies available at the Carolina Duke Inn. So we're prepared, Madam Chair.
Okay, great. And as well, the detention center testing there too.
We're continuing to work with the sheriff with detention center testing. So that's continuing to go extremely well.
Great. And I just want to share also that I was in a meeting last week with Mandy Cohn, Secretary Cohn, and some of her staff. Rod, you were in that meeting, weren't you? Were you at that meeting? Oh, you weren't.
No, as of lately, Secretary Cohen has been meeting with health directors that's on the naughty list.
Oh, okay, good.
That's not been Durham.
You're
I'm
not.
gonna knock on wood. That's not been Durham.
All right, good. So we were having a meeting with her and her leadership staff and members of the Recovery and Renewal Task Force, because they were really, really interested in our community health ambassador program, the Back on the Bull Health Ambassadors. And so that was a great conversation. They were so impressed what we're doing in Durham with Back on the Bull and with the community health ambassadors, because they're looking at possibly doing something statewide. And so really wanted to learn about our model.
Yes, ma'am. I didn't know that you guys met with them, but all I know is like one day last week, I got some questions from some high level people. I was like, all right, I just answered the questions, but now I know they really were intrigued by what we're doing in Durham.
Yeah.
I believe that there's also a similar model going on in Mecklenburg County as well, but again, we're closer to them, so they really want to know what we're doing.
Well, from what I learned is, ours is, ours is. And by the way, I don't know if you all know that Honolulu, Hawaii has modeled our Back on the Bull campaign, and it's called Back on the Wave. So that was exciting to see too. Well, thank you for your great ongoing work, Rod. That is something to celebrate about getting the Latinx community numbers down. And I think things like the Back on the Bull Health Ambassadors that are really doing the outreach to businesses, we're just going to see that continue and grow and get us through the.
I've really enjoyed the pictures that have come from the ambassadors, when they go to the businesses and put the social distancing stickers down and everything. It's real positive.
Yeah, absolutely. All right. So thank you, as always, and for your great work.
Thank you so much.
Okay.
I just want to say one more thing.
Yes.
I have been so impressed with the compliance generally of wearing masks in this community. I was actually pretty horrified. I won't mention the other major city in this state. I don't, but they had on the news associated with the celebrations after President-elect Biden got elected, video of another community. And my husband and I were watching, and I said, oh my gosh, people are out on the streets and people don't have masks on. But in Durham, it's such a different situation. So I want to thank our public health leadership and all the other leaders who have helped make that happen, because we are modeling very good behavior in this.
Thank you, Commissioner Erica. It's a total team effort from you guys on down. It's a team effort.
All right, we're waiting not only with the Biden COVID task force is awesome, but we're waiting for that mask mandate too, right? So
I'm just afraid President-elect Biden is going to see the wonderful things that are happening here in Durham and decide to swoop down and tap somebody like Rod Jenkins for his cabinet.
I know. Well, I already saw a political article that his number one choice is Secretary Cohn for his Secretary of Health and Human Services. So, then they're coming after you, Rod.
Oh no, I can't leave Commissioner Howerton.
Oh boy.
Thank you, Rod.
Yeah. Yeah, you're gonna have to pay him $1 million on that public health board, right, Commissioner Howerton? Okay.
He's doing a great job.
Yeah. All right. Well, thank you all. And next on our agenda is a discussion of the 2020-2021 proposed local legislative goals, and with none other than Deborah Craig Ray.
Good evening, Chair Jacobs, Commissioners, County Manager, General Managers, and everyone. We are coming before you this time on Legislative Goals Part 2. When I came earlier, I mentioned we were working on statewide goals to go with the North Carolina Association of County Commissioners deadlines. And actually that work has begun. They are vetting those goals. I was in an education committee meeting earlier today, and we only got halfway through the list that we had just for education. And Commissioner Carter was also on that call, so she can attest to it's a great group, and we've got a lot of work to do, but it will get done. So where we are today is I'm asking that we work on our Durham specific asks that we want to share with our Durham delegation. The General Assembly will go back in on January 13th, 2021, and typically we approve a package a little bit before the end of the year, and then we try to schedule a meeting with our delegation either in early January or at least by February 1. So we're in good order with the timing. So I sent out an email asking department heads about some priorities that they wanted to emphasize. And so I only got a few, and so we'll go through those. And I also pulled a couple from our last legislative goals process, a couple things that you might want to repackage and try again. And I asked the colleague if I could get a copy of the City of Durham's tentative list. They've not voted officially. I think they actually have a meeting this coming Friday when they will be trying to finalize their list, but I did include it in your handout. And I did call or actually email Durham Public Schools. They don't yet have a package to share, so they're working on theirs. But certainly once we get all of those final packages, we will add them to ours, because we generally try to emphasize certain things that are common. If you have any questions at this point, I can take those, or we can just quickly run through what we have in the handout. And actually there is one item that we did make some adjustments to just this evening, and it's the tax item, and Dwayne is going to walk you through that one. So I am at your pleasure.
Why don't you first just walk us through and we can all hold our comments and questions till you're done.
Very good. So the first item I received was from Ryan Eves, Stormwater and Erosion Control, and I don't know if Ryan is on the call. I did reach out to him this afternoon to remind him. Is Perry or Jay on the call?
Yes, I'm here. I'm here with you tonight.
Okay.
Jay. Good evening. How is everybody?
Great.
What this goal pertains to, what we submitted to Deborah, commissioners, was, you may recall some of the difficulties we've had related to regulation on illicit dumping of sediment, soil materials on various sites. And some of the concerns I think neighbors have expressed to you, neighbors of these sites at various times, or that I think we even had some citizens come in and make a very impassioned plea for help a few months back. And obviously we are bound, if you will, by the limitations within the state model ordinance. And so what we had requested of Deborah for consideration by you, the board, and then forwarding on for further legislative consideration potentially, would be to help us in ameliorating some of these loopholes, if you would, that there could be where our bona fide farms would still have every consideration they need. It would just help us with some of the tweaks we had tried to make earlier this year and been turned down at the State Sedimentation Commission. So it would just be really a refinement of existing legislation as opposed to brand new legislation, I think is a fair way of putting it.
Thank you, Jay.
Yes, ma'am.
All right. The next item was submitted by our youth home director, Angela Nunn. I think Angela is on the call.
Yes, good afternoon, commissioners. Can you hear me?
Yes,
we hear you. Go ahead, Angie.
Okay. So this proposal that I'm submitting is pretty close to the proposal that was submitted last year for the legislative goals to receive capital appropriation to cover half the cost to build the new youth home. I am noting that we have added an additional House Bill 593 to this, as it was approved on August 1st, 2020, which removes all minors from jail. And this is in compliance with the federal requirement to remove all juveniles from all state jails by 2021. Any questions?
All right, we'll keep moving. Thank you, Angela, very much.
Quite welcome.
The next item is the one that we made some wording changes to, and I have actually submitted those changes to Monica so that she can include them properly in the minutes. And Dwayne is on the call, and he can actually walk you through the minor change that we made. Hi, Dwayne.
Hey, good evening, commissioners. The goal that we submitted that you see before you is basically the program that we started this year, the new tax relief program. We have authority to do this. What we wanted to change was locally, instead of having the taxes deferred, we wanted to have those taxes forgiven, if there's a way to do that. So you have the draft before you. Monica, I don't know if you can pop that up on the screen or not. If not, I can read off the changes as well. So the new goal reads, Durham County seeks legislation to forgive taxes to allow Durham County property owner with a household income 30% of AMI or less, determined by HUD, and has owned the home as a primary residence before 2010 to apply for the tax relief program. And here's where the changes come in. Once a qualifying household income is brought forth and verified, a qualifying owner will pay 4% of income in taxes, and Durham County will forgive the remaining tax bill. So that's the change. Instead of the program being a deferment of taxes, and with that deferment being a continual, perpetual increase in interest as well, the goal is to forgive the gap in that tax bill each year.
So has that, a question, Dwayne, has that a conversation that I'm getting tangled up with letters here, NCACC has discussed so far?
No, so the statewide goal that we submitted was what we talked about a lot during development of this program. So the statewide goal was basically eliminating the age requirement from the circuit breaker program. All right, so anybody could qualify. The goal is that anybody can qualify for the circuit breaker program that meets the income requirement. Right now, it's 65 and older. And the circuit breaker is a little different than what we have in Durham, because the circuit breaker, the reach back on that is only 3 years. Whereas this program, it's going to be at least 10 years. So that's why it's more advantageous to get into the state programs, especially the circuit breaker program, because there's only that three-year fallback, if you will. That's what we submitted to the statewide goal.
Mm-hmm. It'll be heard tomorrow, actually, in committee.
Okay, thanks.
Commissioner Carter?
Yes. Thank you, Dwayne, for making those changes. I think it's much better. I was worried that we were just trying to get permission to do what we were already doing. So yeah, I like this seems more like the tax assistance grant program that we were hoping we would be able to enact to really help our long-term low-income homeowners, especially in gentrifying neighborhoods, be able to stay in their homes. And so I think this is something we really hopefully can do in Durham if we could get this approved. My only question is, I can't remember how closely the wording of your proposal, Dwayne, aligns with what the city's asking for, and would it make good sense to try to be lined up together, to push forward together for this change?
Yeah, and I haven't seen the city's proposal either, but it would make sense. I can, Deborah, we can reach out to the city. And
I noticed Deborah included it for us. I just can't remember how close. I think there are some differences, but I think the general idea is the same. And I want to do whatever you all think will give us the greatest opportunity of making this happen.
We can work with the city. Yes.
The difference, looking at the city's plan, is that they would cap it at 3% of household income, not 4%. And then they would receive a credit for the amount above 3%. So the only difference is the 3 versus 4. But the 4 aligns, as Dwayne has said, with another state program. So maybe it's a better fit. I don't know. What do you think, Dwayne, in terms of getting it approved?
Yeah, I would say that the 4% standard, it's out there. We're not. I think we'd have more success in changing as little as possible with going with what the state has already afforded us with another program. Seems like that would stick a little more than trying to change the amount of taxes paid to 3%, along with some other changes as well. So it seems like the 4% would stick a little more to me.
Well, thank you. And so we'll be great if you both could follow up with the city on that.
Indeed, work on that. Thank you.
I have one other question. Do you know how many other counties are doing the exact same thing?
I am not aware of other counties doing this. So no, Mecklenburg has a similar program out there. But outside of Mecklenburg, I have not heard of any other counties doing a program like this.
Okay. And my question is related to getting as much support as possible when you can get a lot of other counties involved in around the same issue. You have a lot more push behind it.
Yeah, now I do know there is interest with some of my colleagues. We recognize the inequity in the law. So there is interest, at least at my level with my colleagues. You know, one of the other things is the inequity with the homestead exemption. You know, a single person who owns a property can make $31,500 a year and qualify for the homestead exemption. But if you're married, you're almost penalized because you are held to the same income standard for married. And you know, that's something for years that some of us have been trying to get changed. It's never worked out. So there are some inequities that we recognize.
But just to clarify, Dwayne, we're going after local legislation, right?
Yeah, local. This is
just for Durham.
Yeah.
So,
yeah.
You know, we may want to strategize. Deborah maybe could initiate this with our local delegation to see whether we call it a pilot. You know, sometimes they're willing to allow one or two counties to try something and see how it goes. So, and so that might be the way to maybe present it. But I think you should talk to our legislators and get feedback on what they think is best.
Deborah's going to set up also a session for us to meet with our delegation, at least a virtual meeting.
Yes, I've already informed them that we are working on our package and we will be getting back with them, so they know.
We'll have the opportunity to actually talk through these things with them. And I actually spoke with Senator Woodard on Saturday. I saw him and he was asking where we're at with our legislative goals. So they're ready to receive them and work with us on them, for sure.
Thank you. Yes, support local farmers markets. And I need to apologize to Mike Dupree because I forgot to remind him that we had this item on the agenda. It actually came forward when we were having some general conversations about food insecurity. And so this came from that division trying to find some additional funding for some of the local farmers markets because there are a few of them that have gone out of business. And I guess it's kind of it's straddling a fence because again, it's, you know, a small business. They might have been able to get some money, but just did not. But again, we're looking for some possible funding for the local farmers market. And so that is how this one ended up on our radar. And so the last items on this list were two important pieces, were priority items for you for the 2019 session. And it was legislation authorizing Durham Public Schools Board of Education to provide affordable housing assistance for teachers and staff. And bills were filed both in the House and the Senate, but we never could get it through session. So I know it was a priority. I believe it was also a priority for school board. So I thought you probably would want to repackage that and carry it forward for the 21 session. And the other item was around increased court funding for the 14th Prosecutorial District. You know, traditionally we've been fighting for many years trying to get increases to support our court system. And again, because I know it's something that you all have been very much in favor of, I added that for your consideration.
Well, thank you so much, Deborah,
Yeah.
for adding both of those. They're both really important. And I know our district attorney will be very happy for us to try to push that forward as well. And of course, with the Durham Public Schools, we got it through the House. We just didn't get it through the Senate.
Right.
So yeah, we definitely want to keep working on that. And I noticed that the city had that on their agenda as well. So yeah, thank you so much. Deborah, was there anything that you thought that was on our NCACC legislative goals that you thought would be good to also bring up, especially with our delegation?
And I did pull that list. I've actually got a hard copy there. So I was just kind of thinking the justice and public safety item about trying to get better reimbursements from the state. I thought definitely that's something you would want to emphasize. Let's turn it around. I apologize. Also, we wanted to support the notion of getting increased funding for the schools, capital needs, and I thought that was something that was important because, you know, that need always exists. And also there was one about transit and transportation. Again, that's important. We are still a growing state. I mean, you know, we had 6 major announcements in Durham County this year, despite a pandemic, and we still have people coming into our community, and so transportation is continuing to be an issue. Of course, the human services area, the ones that were on Ben's list, I think are very important. I would suggest that we add those, and as well as the priorities from Rod for public health. So those are just my suggestions.
Deborah, are we putting school construction back on?
Yes, that was the one, sorry, number. Yes, that was the one that we're seeking revenue sources, including statewide bond and lottery proceeds to equitably address the public school and community college capital challenges.
Okay.
Well, Deborah, those sound like great suggestions to add to the other ones that you already had. So thank you so much.
Were there any city goals that you wanted to focus on? I know we sent out that list.
Well, they had on the list, you know, expand Medicaid.
Mm-hmm.
You know, I know we're all for that. I don't know whether we want to add it to our official list or not.
Yeah. I mean, that's a good thing to put back in there.
I don't know. I have kind of mixed feelings about that, and I kind of come down around, you know, we had an election last week, and, you know, we've got still a Republican General Assembly and a Democrat governor. We know what happened last couple of years. So that's just my lens. Certainly you all have the final authority. If you want Medicaid, we'll put it on.
Well, I guess we could have a conversation with our delegation about what is going to be the strategy to the fact that we still have, you know, 500,000 people who don't have health insurance. And now, because of the pandemic, an additional 275,000 people who have lost their employee health insurance and are now also, if we had Medicaid expansion, they would have been able to have health insurance. So,
yes,
you know, the crisis is just being compounded by COVID. So definitely a conversation we want to have with our delegation.
So we will add that.
Yeah.
Trying to scroll down the list again. Anything other than that? There are a few COVID-related things. There's some infrastructure things. a racial equity training for all of the General Assembly. I know.
Sorry.
Yeah. So again, if there was something on there that you wanted to add to our list, if you want to think about it and email me tomorrow, that's fine. Again, we're trying to put a list together and bring it back to you on the 23rd. So if we need to do a little more research and a little more work to have it ready for approval, that's what we're here for.
Yeah. One thing I would say is when we make everything important and nothing's important, I hope we'll be selective and go after the stuff that we both really want, but also that might be doable.
Right, that's a very good point. That's a good, we don't want to throw in everything but the kitchen sink.
And I agree
Well,
with
maybe
that.
you want to prioritize.
And the other thing that I want to lift up is when we're dealing with the association, which is all 100 counties, we want to make sure, my experience is if it's primarily Durham, they will not push it forward. It has to relate to other counties other than just Durham. Because I've heard the conversations. It's a Durham issue. It doesn't relate to us. So we want to make sure that we're pushing things that it's not just Durham related. I mean, we can push those to our legislators, but when you do it with the association, it just doesn't go over well. Am I correct, Deborah?
Yes, you are. Typically, we try to get a coalition of some of the issues. If we can get, your Wakes, your Mecklenburg, your Guilford, your Cumberland to kind of join, we have a little more muscle working on some of those statewide issues.
Just to be clear, we are talking about local bills, right? This is actually, we're talking about what we're going to share with our Durham delegation specifically that could be potentially local. It could be not, but it could be local as well.
Yes.
Just to make that distinction.
Some of the things we were talking about, that's not just local. Some of them are local and some of them are not.
Right. Right.
And remember, we do a difference. We have seek, and then we have support items. So the seek items are the ones that we are most interested in, really, really pushing. And the support items typically are from another source. So we do try to separate them that way.
Well, thank you so much, Deborah, for your ongoing help with this. And you'll keep us posted. I know I'm participating in some of the NCACC committees as well this week. I know all of us probably will be doing different ones, but you'll keep us posted on those as well. And thank you for participating.
Absolutely. I think I'm on most of them as well. So we'll be working on them.
Okay.
My pleasure.
Thank you. Okay, and the next discussion item is the board discussion on hazard pay and the FEMA reimbursement process. And I just first of all want to thank staff who has provided us a lot of information over the past few weeks and even today and over the weekend. So thank you to Claudia and Susan, David Aids and David Aides, and also Keith Lane, who so a lot of folks have been giving us a lot of information, and I know that there were a number of commissioners that want an opportunity to just have kind of a big picture discussion about some things and to be able to just at a board level to check in about this issue and the process and kind of next steps and where we're at. So I just wanted to give everybody time to be able to have that conversation. I have a few questions, but I'll wait and see if anybody else has any questions or comments or anything that they want to discuss?
Madam Chair,
Mr. Reckow?
I had a question related to the funding of the differential pay. It going back, I guess, to the September 8th work session PowerPoint, it looks like money is budgeted from the regular pay line item. What concerned me is that in getting something clarified today, I learned that we're funding the $4.5 million that we have for funding extra COVID expenses comes out of the freeze on employment, and so that would be the regular pay line item, I would think. So it seems like we're tapping into that already, and so I didn't understand how we could be paying the differential pay from that line item also. Does that make sense, the question I'm asking?
Commissioner Reckow, this is Claudia. That's a great question, and I think, you know, as Keith and I were talking, there's so many different moving targets with these dollars. It gets easy to get them all sometimes tangled up. For when the board adopted the budget, they set aside some dollars that were to cover COVID expenses. And David and Keith shared some of those tables. Those dollars were a result of us transferring funds into the budget from the capital improvement plan and from other sources, so they were not set aside from the frozen positions, okay? The dollars that we set aside for the frozen positions, we will use those for revenue shortfalls. So we had a total of about $8 million that we planned for COVID type expenses this year. $4 million was for, $4+ million were for sort of those items that we couldn't fund through CARES, and that we had a list and we have about $1 million left. And then we said, we know we may have some revenue shortfalls, or we may have expenditures that may come up beyond what we held back or that CARES can't cover. We looked at those dollars that we would primarily look at using in the second part of the year from a planning perspective. And so those are the two different pots of money. And just to give clarification about the holdback with the salaries. And I'm not sure if it was explained that way, but the way you shared it, I wanted to clarify that.
That's a little different than what I thought I read coming back in the answer from Keith Lang this afternoon. I'll have to go back and
Sure.
back.
Okay, and this is Susan. So what I did was I did an analysis of the personnel budget portion of the entire budget for all funds that have active employees in them. And when I did that analysis, I could see that the frozen budget has been removed. But then I did an analysis of where we are to budget, because it was brought to our attention that some places were over 25%, over 28%, whatever. So when I looked at each cost center, I took out the differential pay that had been paid to date for the first quarter. And in that report, which we can definitely provide you, it shows that the differential pay is immaterial. It is not the cause of being over the 25% for the first quarter. I don't know what the issue is. Some of them don't even have a budget adjustment from the original budget to the final budget. There's been no change, but they're at 25, 28, 33, 36%. So something's wrong. I don't know what's wrong. And that's why we've been working with budget and with Claudia to see what approach needs to happen to figure out why we are at that point. But the differential pay is not the cause.
Well, the C,
Aware of that.
I'm pretty sure I don't know, is Keith on the call? Because I thought, in my head, had thought that those funds that we set up were coming to some degree out of fund balance, and they're not. And then he said, no, they're not.
I'm sorry. They are coming from fund balance for the first $4 million. And there was a second pot, maybe I misunderstood your original statement that we were freezing positions. So we froze about $4.2, $4.5 million worth of positions that we set aside to cover revenue shortfalls or expenditures that were above the base budget. But you're right, it is coming from fund balance, which is a little bit different than the frozen position personnel line items that I thought you had referenced, but I may have missed.
Okay. All right. Well, I'm going to cede to someone else while I recollect my thoughts, because I'm even a little more confused now than I was. All right.
Anybody else?
Well, I agree with Ellen. I'm more confused now. Especially Susan's comment worries me. I didn't really understand it. It just didn't sound good. It sounded negative.
Well, it is, it's not negative. It's part of it is that we've not done the budget adjustment for the CARES funding in this year's budget. It's a timing issue. So there were, each year about this time, we look at where the budget is for the year. And there has been conversations about, well, what's the impact of the differential pay? So finance was asked to drill down further on that. And so what we're discovering is that the differential pay is not the issue. It's the timing issue of how we've been doing, making some budget amendment adjustments. So for an example, we received dollars for the Board of Elections to support the current election. And if you may recall, we increased their budget for workers for hazardous pay, $5 additional an hour, and also to recruit people. They also added on 2 additional sites, and the $1.4 million grant that was added to the county's budget to cover that expense, those dollars just need to move into personnel. So when we recognize the dollars, they were all in contractor services, which is operating. This is way more weeds than you need to probably want to know. And so we just need to move it from operating up to personnel to cover that expense, because it is not uncommon when you have a grant that it may be in one line item and then you have to move it to another. So it's those kinds of things that we are working through. And, when I mentioned, I think maybe in one of the board items, in one of the exchanges with the board, that we're coming back to do all of those reconciliations so that we can finalize those things as we finish up this year, especially as it relates to CARES funding. The other major budget amendments that we have to do is related to CARES. So again, similarly, the state's process is a little bit different with the way they're allowing jurisdictions to recognize the dollars. You basically have to expend the money, and then you can recognize that revenue. So that's a little bit different. So because of that methodology, we've been slower with actually doing the budget amendment to recognize the $8 million that came from CARES. So that will also come. And so once we do those adjustments, what Susan talked about will resolve itself. And we're also looking to see if there are other things, but that's sort of the normal processes that we're going through. And I know from her overview of where we are from a quarter perspective, those kinds of issues from a macro level didn't show up, and there was about $8 million that we hadn't added to the budget. So again, probably more weeds than you want to know, but that just gives some perspective.
That's correct. And we're continuing to monitor through the compliance section in finance all of the grant-related funding and the expenses that are being applied to support those grants through the GM module. So we're constantly monitoring that.
Wendy, you're mute.
I guess, you know, we could get really into the weeds, and I know, and so I'm going to just ask some more big picture questions that I have. And, you know, I know that obviously you can even hear from this conversation how hard everybody is working on this, and how we are in totally uncharted territory with this pandemic. I mean, when we started on March 13th, we had no idea that we were in for a pandemic that would be lasting. Here we are 8 months later, and there's no end in sight. We have great news about the Pfizer vaccine. Thank goodness we're going to have a COVID task force set up by our new president, but, you know, we're still in the middle of this. And so, you know, when we approved our budget last year, even, we had really no idea what to expect, because we're actually almost through. We almost don't have any money left in the COVID fund that we had created for our board. And in one quarter, you know, we're almost through that allocation. So I guess my concerns are more big picture. They're more about process and really just the unknowns, and just how many unknowns there are. And so I guess, Mr. Manager, what I would like to ask you is, you know, we started doing the hazard pay, you know, March 13th with the plan to submit to FEMA. And so, you know, what is the timeline for when we are actually going to submit, since we've already went through, you know, one fiscal year, and now we're into the next fiscal year with those expenses. We're into another budget cycle, another budget. And, you know, what is the plan for when we are going to submit, so that we know how much is going to actually be covered?
So you won't know even when we submit how much is going to be covered. And I think we said that to you, Madam Chair, and the board the last time we had this conversation. Because obviously, once we make the submission to FEMA, they will look at the submission and make those determinations. Obviously, first responders is one that, you know, we feel reasonably comfortable about. But let me just say that as it relates to the timeline for submission, Susan, she got experts that work with her over there in the finance department that subsequently can talk more specifically about the timing of when those invoices and everything can be packaged for submission. But as I shared with the board in previous communications, it is our intent primarily to evaluate the standings in January, so that we'll know precisely where we are. The majority of those revenues that we have coming in, you know, for personal property and sales tax and occupancy tax, we will have a better idea at that time, and then that's going to give us, you know, a good opportunity to sort of not only understand where we are at mid-year, but just as importantly, to think about the work and some of the decisions and framework that we'll have to put in place for the 21-22 budget development. in addition to the information that you received over the weekend, Susan also attached at the end of it that fund balance projected statement. And as you saw there, as of June 30th this year, it's looking like it's projected to grow by about $9 million. And of course, that doesn't take into account the benefit, from the CARES funding, which is also in that revenue column as well. And so we're going to continue to monitor the budget for on the expenditure side of the ledger and look at those gaps that may occur and make some decisions. But we won't know anything with any certainty until we get to the January time frame. That data that Susan has prepared for you, primarily what it tells you is this: that financially, in terms of our overall fiscal outlook, we're in a pretty good place operationally. And those approaches that we put in place thus far have worked pretty well, which is effectively what's giving us the ability to have those fund balance growth projections that you're in fact seeing. And these are the things that we talked about in the budget presentation in respect to specific strategies we were going to put in place for revenue protection. And so far we feel pretty good about that. What I believe is that, once we get to the mid-year analysis, that's what's going to give us the opportunity to have a rather thoughtful, strategic way of looking at things, just like we do every year. And what I want to do effectively is to make sure that we don't create any unnecessary panic or any consternation within the organization or the operation, which in my opinion is really not a way for us to sort of manage the organization. And I would ask that you remember we are almost a $700 million operation with about 36% of our funds in a reserve. And so I think that we are in a good enough place. I think that, count the strong financial management that we have had over the years, and as we are recognized by our peers at the local government commission, rating agencies, the principles of sound financial management that we have in place, it's afforded us the opportunities in past years to manage in difficult situations. Right now, today, if I had to guess, I would say that we're still in a pretty good place, given the protective measures that we have taken throughout the last 6 months. And so that's what I will offer.
Well, I appreciate everything you just said, Mr. Manager, but my basic question was just to give our board an idea of what the timeline. I just had a very simple question.
That is a technician's question, and those folks work for Susan. As the invoices come in, Susan may be able to give you some insight in respect to where we are. You said very early on you wanted to have this conversation at a high level. We packaged that information in order to let you know where we stand financially. Susan, if you want to weigh in, if you have any insight.
Yeah, that's fine. I can just share a couple of high-level bullets on. For one thing, it's a timing issue. We've continued to focus on the applicable expenses for CARES Act funding because of the time limit. FEMA doesn't have the time limit CARES Act does for the expense of the funding source. So some expenses might qualify for 100% of CARES Act funding, or perhaps some not so much with FEMA. And some examples, maybe more stringent criteria, a portion would be reimbursable, et cetera. So we've tried to be strategic in our application of expense to CARES Act funding to ensure we are smart with which funding source we apply an expense, which is a standard best practice. Also, it's important to remember that when the pandemic happened, it was during the same period we experienced an unprecedented malware attack, which required a transition to a paper process. It was a huge undertaking for a $700 million operation. It was seamless to most because of our business continuity plan but it did put us a little behind. Also, we needed to document, because this is the first time for us, so we needed to document a process for filing with FEMA, CARES Act, and other grant awards for COVID. It was a strategic plan with strong internal controls to ensure that there was no double dipping. We can't afford to be slack or lax in any way and file for FEMA when we file for CARES Act or when we file with this grant. So the process, we're getting closer to filing for reimbursement. The CARES Act took first priority because we need to make sure that we optimize 100% of those funds. So we're going through the reconciliation process now, and we're discovering some areas that should be applied to CARES instead of FEMA to expedite funding reimbursement. We're coming to the board in a couple of weeks with some reconciliations and adjustments that probably need to occur to realign our plan for the CARES Act. There needs to be a final revised plan, and we're working with Jody, Claudia, EOC, Jim, budget, to make sure that that happens efficiently. All the funding sources also, just FYI, whether it's CARES Act, whether it's grants, are being managed by finance through the GM module, the grants management module, and they're being overseen by our compliance manager in finance. So we're working on it, but we're trying to make sure we do it right and smart.
I mean, I just say, you know, what I'm concerned about is that we spent, this is an expense that was not approved in our budget. And so then we obviously have to find the money for it one way or another. And so we've already spent, even in this budget year, 1.4 million. And so if we keep continuing without knowing the source of the revenue for it, if you just multiply that out, it's just one quarter, we're already going to be over close to $6 million by the end of the year. And again, you know, when we look at the benchmarking peer data that you provided to us, we just don't have anything to compare it to, because out of the 6 counties, 5 only did this in their budget for 3 months, 2 or 3 months, or they didn't do it at all. And then the one county that's still doing it, they have $194 million worth of CARES Act money that they're going to use to cover it. So unfortunately, we don't have anything to go on other than hoping that when you are ready, and I understand, Susan, it's no fault of your own, that with the malware attack, that it's, you know, you've got to have it right. But it's just, it's a chicken and egg thing, and you know, we have the responsibility ultimately for all the budget, and fiduciary responsibility lies with us according to, you know, general statute, whatever it is, GS 52.8, I remember the name of the statute, 153A. And so, you know, it's just, it just puts us into, I feel the responsibility of uncertainty about it. And I'm just, you know, again, it's all the other unknown expenses as we go along. So obviously it will, you know.
And just FYI, for CARES Act reimbursement, we've applied EMS salaries as much as we could, because right now the current plan has 1.8 million for salaries and benefits. So we've applied as much as we could without exceeding that budget amount for CARES Act as the current plan exists. Like I said, we're working with the other departments to come back with a revised final plan that may increase the salaries portion, but we're not there yet. So we can't submit anything yet until we have the revised final plan. DSS, FYI, per Ben is filing their differential with their salaries on their 1571 monthly reimbursement report. So the only thing we would have to file there is the difference between the percentage of what the state has reimbursed. So that's less amount there. I think there was another department, but I get it.
Yeah. And yeah, we got the cover story of Governing Magazine today was, which I share with everyone, and then I think Commissioner Redcap sent the same thing, was, you know, local governments don't expect any more funding coming from the state and federal government now with the outcome of the election. So, and we just, have so many needs that we're looking at in the coming year. So, well, I'm going to stop there.
So, Madam Chairman.
Yes.
Just for the board's edification, first thing this morning, Deborah, Craig, and I had an opportunity to spend about an hour on the phone with Congressman Price's office and his staff, of course, at their request, and primarily their reason for wanting to have the conversation today was essentially to highlight and outline what we thought some of our key funding priorities were going to be going forward. And, they were very apt to essentially say to us that they didn't think, given the two bills that obviously had been drafted for funding, that anything would happen between now and January 20th. But one of the first efforts that they thought would be put forward as far as the Biden administration was to get some legislation passed and new bills for the purposes of addressing some of these concerns at the state and local level. So we just had that conversation for about an hour this morning. Obviously, there's a great deal of uncertainty, concern on all sides, but I'm sharing with you what we are hearing. Thank
you. Hey, I didn't know if any other board members had any questions or comments. I guess I have another question, Susan. You mentioned about the CARES Act money. Is it possible that we will have money that we could use, for instance, to help small businesses? Because if we're not going to use the money for other things, because that actually is one of the funding sources where we can provide direct grants through the CARES Act money, and we can't do that through local funding. And that would be a really, really important way for us to use that money for needs in the community.
That would probably be a Jody question and a Jim question, because they're the ones who revised the plan. I'm not sure that I can answer that question without Jody's input.
Mm-hmm. Okay, because I was in a meeting last week with a lot of small business leaders, and they are just in really dire straits because, again, of any sector in our community, our retail stores, our restaurants, a lot of our local businesses they're bearing the burden of not able to fully have their businesses up and running for the public safety benefit. And so, and let's face it, they pay rent, so then it affects our property owners who then can't pay taxes, and it affects the revenues that we have coming, sales tax revenues. But I know that we can't use local funding for actual grants.
Mm-hmm.
But I know the CARES Act money, we actually could do direct grants, and they were saying they could use help with things like outfitting their space for ventilation, so to help in the winter as we move through, getting through the winter, surviving the winter, outdoor heaters for doing things outside. There's just things that would really help them get through the winter.
So I understand. My only concern would be timing, because we're at November 9th. We only have until December 30th. That's my only issue, but I'll defer to Jody to respond. Jody?
Good evening, Madam Chair, members of the board. Madam Chair, you are correct. CARES funding, which comes through to the county through our CRF plan, does allow for loans and grants to businesses and within communities. And so if the board wanted to do some additional funding for grants or loans, we would need to do it through our CRF plan and the funding that's allocated. To Susan's point, though, we are now in the process of reviewing the plan that was approved and submitted on September 8th. And so we'll have a better sense within the next couple weeks how money needs to be reallocated to make sure we're leveraging all the dollars that we possibly can to make sure that we're meeting the requirements and deadlines for our CRF plan and this CARES funding, as well as funding for FEMA reimbursement. So there may be some areas of money that was underspent
or needs to be reallocated because priorities have changed or recommendations have changed or requests have changed, that we may be able to allocate to that purpose. But to Susan's point, the window is getting smaller regarding spending this money, and the guidelines are very specific. Coming down from the U.S. Treasury, it's not having the money budgeted or a contract. You actually have to have services provided and the money be paid out for services or provided within the community. And so that's why it's really important that we look over these spending items line item by line item.
Okay, so Jody, if you could keep us posted on that and whether it looks like there may be the opportunity to reallocate some of that funding for community needs, like our small businesses, and certainly I can connect you with, what we heard from the small businesses last week at that meeting and what some of their needs are as well.
Certainly. And
yeah.
we'll be providing an updated and amended plan for the board's consideration. We're targeting the next meeting in November to make sure that we're in compliance for meeting our December 30th deadline. So we'll continue to work on it.
Okay, thank you.
Madam Chair, perhaps for that next meeting at the end of November, if we could really perhaps try to, as clearly as possible, spell out where monies are coming from, particularly from our local budget, I think it would be helpful.
Yeah, I agree that the September 8th, all of the information that was provided us about all the local expenses, and if we can get basically an update, I think Claudia and I were talking today about, yeah, and she said, yeah.
Because I usually understand budget stuff pretty well, but I have to say the movement of money and how things are being handled is confusing with this. So we could try to make it as clear as possible. That would be helpful.
We agree.
Thanks.
Yeah, we do have that same challenge with it because of all the moving parts.
Right. Well, it's unprecedented, and that's why it's so challenging. Yes, Commissioner.
I think one of the sort of issues and challenges for us is that over time we've kind of had the fear of God put in us about needing to tap into fund balance ever, because we don't want anything to jeopardize our AAA bond rating. And I feel like now we're, holding the fund balance up, the $9 million. If we have to dig into it, we probably won't have to, but if we have to, we'll be okay. That just feels worrisome. But what I mostly hear you all saying is you're confident that A, we're going to be in compliance with FEMA reimbursement, and B, if we're not, there's fund balance and other sources to cover it. That's just, so at this point, I just sort of feel like even though a bunch of us have expressed concerns, we just kind of need to step back.
Well, and Commissioner Carter, to your point, if you may recall, back in June when we talked about where we thought we would be at the end of 1920, at the end of June, we thought we were going to actually use fund balance based on, at that time, which was June, where expenditures were, also what it looked like optics-wise with sales taxes. Sales taxes came in higher than expected. Spending for departments, they were at similar levels as they were the year prior. And so when all those stars aligned, although at that time we thought we would use the reserves, and we do hold them real sacred, because we know there will be those times when we have to use them. And so we're grateful that it's a better picture Right now, we're projecting for the year-end fund balance for 2020. However, if it is a situation we do have to use them, it's still something we try to not do. But for the current year, we are hopeful that we won't, but we will also manage accordingly. There are ways that you can manage your sort of spigot, as I like to say, to make sure you don't go over budget, and that you do hit those targets. And I often talk about my times when I had to have these double-digit cuts, and faced with expenditures you had to do, and you sort of manage the budget accordingly. And so that's what we try. And we didn't get to that $9 million by accident. We did. We froze positions, we stopped certain spending. So it was a planned effort. Again, it was a bonus that the reserves, the sales taxes came in better. But we know this year's a lot of unknowns. And so over the next several months, we will shift accordingly, but try to do it in a way that protects those things that are of highest priority.
Commissioner Howerton.
Thank you, Madam Chair. First, I'd just like to say to the Durham County employees how much we appreciate the work that they have been tasked to do and the tireless responsibilities that they've taken on around this pandemic, addressing all the community needs that they've been asked to do. And I'm sure some of them have worked around the clock. And I appreciate all the updates recently. We've gotten an awful lot of updates about this matter and others, about screenings and county performance, build in county delivering services, around delivering foods, items for families. You can't even go down the list of things that they have been responsible for. And I just want to acknowledge and thank the employees and also the Durham community and all of the people that have worked in the trenches. That Rob couldn't do the work that he has done by himself. So it's been the employees and it's been the community. And, I absolutely agree that as commissioners, we have a fiduciary responsibility to make sure the taxpayers' dollars are used correctly. I think Ellen and I had some concerns earlier when we were getting a report around spending dollars and not doing strategy around the dollars as to how they were being spent. But I think listening to this conversation, we also must exercise a little bit of patience here and allow the staff to help us to understand the federal and grant process, the compliance. And we've got experts here. We've got experts that know this stuff a whole lot better than we do. And that's why we hire them. So I'm just wondering if we are being impatient here, and I'd like to think that we're willing to give experts the time to give us the numbers that we're asking for, to make sure that we are knowledgeable about what it is that we are trying to do, because right now I don't think we understand enough to make decisions around this. They're telling us that there are timelines regarding different areas, and we're still asking questions about the timelines because we don't understand why the timelines are. They understand the timelines. So we got FEMA, we got the CARES funds. So I think there's got to be some real careful planning here from the commissioners to allow the staff to be the experts that we've hired them to be.
Okay, thank you. I want to give Commissioner Hill a chance to talk if he wants to after all of us outspoken women have spoken.
Thank you, Madam Chair. Yeah, I'm going to piggyback on my colleague on what Commissioner Howerton said. You know, we are kind of treading into the unknown, right? I think all of my colleagues have kind of hinted on this, and we don't know what's going to happen in the next few months. As far as COVID, you know, that 90% rate sounds great from Pfizer, but what happens if that turns out not to be the case, right? This is a vaccine that has to be stored at, I believe it's lower than 50 degrees below zero, right? It's a vaccine that requires 2 doses, right? One 21 days apart from the other. So we don't know when we're going to get this, when it's going to be shipped out. This is not always. This is not totally an American effort. It's also an effort by our German partners. So this isn't just a vaccine that's going to be issued in the United States. This is a global effort. So we don't know where we're going to be in a few months. And we still have citizens, unfortunately, that will not wear a mask, right? So as we venture into this kind of unknown, you know, we talk about what are we going to do, and maybe we should give people time. Well, not doing something is doing something, right? And we need to be particularly careful with the taxpayers' money. And I know one of the votes that I've taken this year that still upsets me was a vote not to bring all DPS employees to $15 an hour. Now, we did that, or at least I did that, or I made that vote, because we didn't know what we were treading into, especially that time of the year. We didn't know where we were headed financially. And I took that vote because I wanted to do what was most sound for the county. And it still touches me today that I had to take the vote. But I did what I thought was right. And now it seems that we are spending money that we cannot. I mean, is someone here going to guarantee, going to sit there on their job and guarantee me tonight that it's going to reimburse that money? Can I get someone to sit here and guarantee me that today? No, I can't. Okay, so that's the thing. We have to be very careful. And like I said, taking no action is taking an action. So I'm just concerned that not myself or Commissioner Reckhow will be gone. But in the next few months, the new board will hear, oh, we're sorry, not going to be reimbursed. We're going to go into fund balance. And what I really fear is next time we talk to people in New York, that they say, oh, I'm sorry, you guys don't keep your fund balance at a certain level and you're losing your AAA, your AAA credit rating. And that's what I really fear. So, yeah, I find this all very disturbing. So, I hope that, as I said before, that FEMA funds our spending, something that they will reimburse. But if not, what happens then? Thank you.
So, one other thing, you know, I've worked with FEMA before. I worked at the state level. When the fires were, was it in Hamlet? The chicken farms burned down and people were killed in those buildings. And I sent down to work through that process. So FEMA and being a part of the association and being the president, I've seen FEMA don't pay you right away. If floods happen, FEMA gets to you when FEMA gets to you. They don't turn it around. We want it to happen now. That's not the way they operate. And I hear what you're saying, James, but there is no guarantee in anything in life. The only thing I know that's guaranteed is death and taxes. And so, and you're not gonna get out of this life alive. I believe that any discussion about any hazard pay at this moment is quite premature. When Dr. What's his name, Foch, can't really pronounce his name, the scientist, and other public health experts across the country have said we have now entered the deadliest season of this virus, when more and more people will become infected and die. We must use our best thinking and ask, is this the right thing and the right time to make a decision to terminate hazard pay for staff performing frontline and essential duties? What message are we sending to the staff? We have new commissioners coming on in about 2 weeks on board at the height of the pandemic, and they'll be a part of whatever decisions that we have to make going forth around this. So are we willing to, what's the consequences? That we make decisions and the new board has to carry out the process. So I'm hearing, I hear my commissioner saying that it's not something we should be doing. But right now, I don't know how we can make a decision when we don't even have all the information and we don't have the full board going forth that's going to have to manage this decision.
So I just want to respond. I appreciate the comments that you just made, Commissioner Hill, and also Commissioner Howerton. I think one of the basic reasons why this is such a difficult situation for our board is because we never got to make this decision in the first place. This decision was never brought to our board to be assessed, to be evaluated, to have the budgetary impact, to have all the information. You said very clearly, Commissioner Howerton, we don't understand enough to make these decisions. You're right, we don't. And that's a problem because we were the ones to make the decisions. We're the ones that are supposed to make decisions that have a fiscal and budgetary impact. And in this situation, we weren't included, we didn't have the information. And now our staff is working so hard to try to deal with something that didn't have the proper process and assessment and due diligence and thinking be brought before our board in the first place. And that's why our staff, they are working so hard to try to now figure out a solution for something that our board should have been deciding in the first place. And it's a problem.
So, Madam Chair, you're saying that it's our job to be in the weeds here. This is what
budgetary decision.
This is what we talk about around. This is what we talk about. This is what we talk about micromanaging the staff. You've had an attorney to tell you micromanaging doesn't work for the staff. So how do we manage an organization this size? How do we micromanage an organization this size?
This is not micromanaging, Commissioner Howerton. I got expert advice from UNC School of Government finance expert, Kara Melanzi. And I sent the email to our board that this decision that was made was to have been brought before our board, according to General Statute 153A-92. This is not micromanaging. This is a basic.
Read what you're talking about.
Okay, well, we'll just end the conversation here. And again, appreciate all the hard work that our staff is doing to try to address this situation. All right, so we are going into closed session. The board is requested to adjourn to closed session to consider the qualifications, competence, performance, character, fitness, conditions of appointment or conditions of initial appointment of an individual public officer, employee, or prospective public officer or employee, or to hear or investigate a complaint, charge, or grievance by or against an individual public officer or employee pursuant to General Statute 143-318.11A6.
Madam Chair, before we vote on this, I understand that our attorney is not going to be present in this closed session, and I have some concerns about that.
When we're talking about things like that are personnel related, such as this, the attorney is not usually present.
Due to some concerns that we've had lately, I would be more comfortable if we had attorney advice in this conversation.
Okay, that's fine. If that's
Thank you.
Not typical, but that is fine.
Thank you.
Okay, and Lowell, are you here? Just want to make sure.
I am.
Okay, great. Thank you. Okay, so.
Madam Chair, I move we go into closed session consistent with what you just read.
Okay.
Second.
Okay, second by Commissioner Carter. And we'll do a voice vote starting with you, Commissioner Hill.
Yes.
Commissioner Carter.
Yes.
Commissioner Howerton.
Yes.
Commissioner Breckow.
Yes.
And a yes, so we are unanimously adjourned to closed session. Thank you, everyone, and hope everyone else has a good rest of your night.